It increases our risk of diabetes, heart disease, obesity, all these different conditions.
Normal average per day, everyone should sleep 7 to 8 hours. In case they don't take that sleep of 7 to 8 hours,
Sleep debt. This is a relatively new concept that we are understanding in the medical field. So, sleep debt is this negative balance of sleep that is affecting our health. Nearly 40% of Canadians feel more tired. Almost a quarter of Canadians feel that their productivity changes after time change. And as you pointed out, there's safety issues as well. Almost 20% of Canadians have noticed that it's affecting their overall well being. Like they feel unsafe while driving, even if they have 1 hour less of sleep.
someone sleeps more than 8 hours, like 9 or 10 hours in 24 hours time, any effects on them also?
But that's not true at all. The body keeps track, the body keeps score. And if you are not sleeping well, then it can affect your entire waking hours as well, right? So, because for most of us, the wake up time could be fixed, the sleep time is something that changes. So, making the sleep time also fixed. If you feel that your productivity is being affected, if your memory or your focus is being affected, then all these things are a sign that there could be something else that's underlying, and it's important to talk to your doctor about this.
Month of March is a daylight saving time, and World Sleep Day falls in this month, in the month of March. And with the daylight saving time, many Canadians they suffered a 1 hour loss of the sleep. But many more strings are attached to it, like family, safety, and other issues also. So we have Dr. Akshay Jain, who is an endocrinologist and professor at UBC with us to discuss about daylight saving time impacts. Dr. Jain, welcome to the show.
Thank you so much, Nitinji. Thank you for having me on your show.
Dr. Jain, if you can introduce yourself to our viewers, please.
For sure. So I'm a clinical and research endocrinologist. So I specialize in the study of hormonal and metabolic problems like diabetes, obesity, cholesterol issues, so on and so forth. I've been in practice for about 15 years now. I'm the first Canadian physician to be triple board certified in internal medicine, endocrinology, and obesity. And I'm actively involved in a lot of clinical trials and research. And as you mentioned, I'm a clinical instructor at UBC.
Dr. Jain, daylight saving time. So many Canadians they complain about this since a long time, and now British Columbia will not be going with the another time change in November. So can you, because this is not only a 1 hour of loss of the sleep, but many other things are attached to it, like safety issues, driving issues, then family issues, then health issues. So if you can elaborate about this daylight saving time.
Absolutely. So I think daylight savings, we sometimes feel that it is just limited to that one particular day and we had to adjust a little bit and then everything is okay. But as you pointed out, Nitinji, it has a lot of ramifications. So studies have shown that even that 1 hour of less sleep that happens in March, that itself can precipitate that health issues during that day. So we know that the body keeps track. If there is 1 hour less of sleep on that particular day, it can affect our internal body clock because our bodies don't really adapt to it. I have lots of patients that I see in my practice who say that for a few days, even after that, they still have a difficult time adjusting to that. There was a national survey done that showed that nearly 40% of Canadians feel more tired. Almost a quarter of Canadians feel that their productivity changes after time change. And as you pointed out, there's safety issues as well. Almost 20% of Canadians have noticed that it's affecting their overall well being. Like they feel unsafe while driving, even if they have 1 hour less of sleep. So all of these can obviously have an impact far reaching on our health.
In the broader sense, what the national data suggests, as you already mentioned, that 41% of Canadians and they are living in sleep debt. So, what is sleep debt? Is 1 hour of less of a sleep has become a sleep debt, and also 18% admit that they have driven while feeling unsafe after losing an 1 hour of sleep. And there are many others Canadians, those who are struggling with this time change? And Canada has 6 to 7 time zones in within Canada.
No, these are such impactful points that you raise here, Nitinji. So, first and foremost, sleep debt. This is a relatively new concept that we are understanding in the medical field. So, sleep debt is this negative balance of sleep that is affecting our health. So, as the name suggests, it's basically the cumulative effect of insufficient sleep over a period of time. So, what tends to happen is ideally, it is recommended that we should have 7 to 8 hours of sleep. And unfortunately, most Canadians are having way less than that amount of sleep. And with that, we see that these people that are living in sleep debt, they are at a higher risk of developing cardiometabolic conditions. The risk of diabetes is much higher, heart disease is higher. If people are trying to lose weight and they have the sleep debt, then it becomes more difficult to lose weight as well. So a lot of these things tend to accumulate. The problem is we don't really realize it because this is not something that people typically talk about, right? We don't even know that there is a sleep debt because we feel that, okay, on the weekends, I'll sleep a little bit more and I will catch up. But it doesn't work that way. Every single day where our sleep is less, the effect on the body is right away, it manifests.
So, on a normal average per day, everyone should sleep 7 to 8 hours. In case they don't take that sleep of 7 to 8 hours, then the implications already you mentioned. But what if someone sleeps more than 8 hours, like 9 or 10 hours in 24 hours time? Any effects on them also?
Yes, so that's a really good question. So, more than 9 hours of sleep also tends to have an effect on your overall health. So, that's where the sweet spot is somewhere, in that 7 to 8, 8.5 hour range there of good quality sleep, right? So, that's the other thing. A lot of people will be in bed for 8 hours, but if they are constantly tossing and turning, waking up, their sleep gets interrupted, then that's not good quality sleep. Some individuals may have what is called sleep apnea, so the oxygen to the brain can get cut off. There can be episodes where the partner that's sleeping next to them can see that this person is probably choking or not breathing for a period of time. So that's called sleep apnea, and that also affects the quality of sleep. So both the quantity and the quality of sleep should be ideal. Too little or too much is a problem.
Dr. Chan, if we talk especially about South Asian communities and how cultural attitudes and lifestyle patterns within South Asian communities, they may contribute to overlooked or normalized chronic sleep issues.
Yeah, that's such an important point. Culturally, all of us South Asians, we are told that those who sleep less, they will do better, right? In fact, sleeping less is considered a badge of honor. I remember in our history textbooks, we were taught that the first Prime Minister of India, Nehruji, barely slept for 4 hours. They say the current Prime Minister, Narendra Modi, also sleeps very little.
That is
Culture
not good.
yeah, culturally it's ingrained in us. They say there is this saying that says "Jo sovat hai wo khovat hai,"
Yes.
or in English they say if you snooze you lose.
Yes.
So we are taught that sleeping is not really a good thing. If you stay longer awake for longer and if you work harder, then that's a good thing. But that's not true at all. The body keeps track, the body keeps score. And if you are not sleeping well, then it can affect your entire waking hours as well, right? So I think, as you pointed out, from a cultural perspective, this is something that needs to be talked about. The other thing also is that, different, as you pointed out, South Asians are multi generational families, right? So different generations live in the same household. And let's say if there is a new daughter-in-law at home, and if she wakes up later than the mother-in-law, then that's considered to be a cultural faux pas. So that's something that again, the sleep of each generation can get affected. And that's the thing, in South Asians, we don't talk about sleep as much. It's not really a concern. We don't really talk to doctors about it.
Dr. Jan, the impact of daylight saving time on sleep routines and why seasonal disruptions can expose deeper year-round sleep challenges.
Yeah, so that's the thing, right? Because we are seeing that a lot of people already have, so 60% of Canadians have a difficult time already falling asleep, and 70% of Canadians suggest that they have a difficult time staying asleep. So when on top of this you add the daylight saving issues or the seasonal disruptions, it affects us even more. So from a seasonal disruption perspective, ideally, we need to be exposed to sunlight in the morning when we wake up and go about and things like that. So unfortunately in Canada, we during winter months the exposure to sunlight is quite limited. So that alone will overall increase our metabolic health effects. We also say that because of these sleep disruptions, because your productivity is affected, the mood is affected, driving gets affected. So it's basically a big safety issue.
As the British Columbia already took a decision, they won't be changing a time in November now. So, what other provinces should follow now? Because they washed, American provinces also washed, and Canadian provinces also washed this British Columbia's daylight saving time. So, what other provinces should do as per the science, as per the medical terms?
I think the science is there, but it's also important that as a country we are, together in that and uniform in that, because a lot of us, even though we might be working in one province in British Columbia, we might be working from home and coordinating with a team that's across the country. And if one province changes and the others don't, then it creates a lot of confusion as well with our work patterns. And obviously, it can then in turn also affect productivity, because let's say if one province is not changing their time, but the next province has done that,
Yes,
you still
a lot
have to
of
wake up
confusion
earlier or
also.
later. Exactly.
Yes. So, Dr. Jain, can you suggest some practical steps for maintaining healthy sleep patterns through seasonal changes?
Absolutely. So first and foremost, it's important to look at our sleep hygiene. So set a good bedtime and try to stick to it as much as possible, so that you can get your good 7 to 8 hours of sleep. Because for most of us, the wake up time could be fixed. The sleep time is something that changes. So making the sleep time also fixed will allow us to get that. Ensuring that you avoid screen time exposure when you're in bed. If you're laying in bed and watching TV or looking at your phone, that actually still will stimulate your brain and it becomes more difficult to fall asleep right after. So at least half an hour before going to bed, avoid screen time exposure, making sure that there's no caffeine exposure as well. Culturally, some of us may have tea in the evening, and that can then affect our ability to fall asleep. Making sure that the temperature in the room is regulated and helping us go to bed, and fall asleep and stay asleep. In the morning when you wake up, it's important to have exposure to sunlight as much as possible during the daylight hours. And when it's night, you want to obviously have less light exposure during sleep time. So using blackout curtains can help as well. So lots of different things that one can do. If despite this, if individuals are having a difficult time falling asleep or staying asleep, it's important for us to recognize that this is a medical condition. It's a medical disease, insomnia, and it's important to seek medical help. Back in the day, we had some medications that were a little habit forming, and that's why sleep medications weren't being used. But now we've got a lot of really good, safe medications that can be used, and it can help us overcome our sleep debt.
There is a common misconceptions around around the normal fatigue also. So when does the individual should seek professional medical guidance in that scenario?
I think the sooner the better. Fatigue is one of those things that we let slide by for a while before we actually pay attention to it. We can attribute fatigue to different environmental circumstances, or we sometimes say, oh, it's just part of growing older. but there can be a lot of underlying things, sleep of course being one of those. So if you feel that your productivity is being affected, if you know your memory or your focus is being affected, then all these things are a sign that there could be something else that's underlying, and it's important to talk to your doctor about this.
Okay, and then Dr. Jan, if you can wrap this up with the daylight saving time, what is your message on that to the Canadians and also about the sleep debt? Because Canadians should feel healthy, safe, there should not be any implications on them. And with the medical advice from you, what they should do on daylight saving time and sleep debt.
Absolutely. So even that one day, if you don't sleep for that 1 hour, it can affect your health that particular day and a few days after as well. So during daylight saving, just make sure that you plan ahead and go to bed earlier so that you can still get those 7 to 8 hours of sleep and it doesn't disrupt your body. That's as far as the immediate management of daylight saving is concerned. It's also important to listen to your body. If you feel sleep deprived, if you feel that you haven't gotten adequate rest, then it's probably best to avoid using heavy machinery or driving because you're putting your health and others at risk as well. And as far as overall sleep debt is concerned, this is a very serious problem. It's one of those things that has effects that you and I don't realize, where it increases our risk of diabetes, heart disease, obesity, all these different conditions. So it's important to talk to your doctors about it if you're not getting good quality and quantity of sleep, because this is something that needs to be managed head on so that you have a healthy, productive life.
हमें ये मैसेज आप अगर हिंदी में भी दे दें कि कैनेडियंस बिकॉज जैसे हमने डिस्कस किया प्रोग्राम में कि डे लाइट सेविंग टाइम इसके इम्प्लीकेशंस हैं, इसके साथ स्टिंग्स जुड़े हुए हैं, फैमिली इश्यूज, सेफ्टी इश्यूज, हेल्थ इश्यूज एंड स्लीप का जो कमी है, डेट, स्लीप डेट जो कैनेडियंस फेस कर रहे हैं, 41% ऑफ कैनेडियंस जो है उनको प्रॉपर स्लीप नहीं मिल रही। एंड एज पर यू जो हमने प्रोग्राम में डिस्कस किया कि 7 to 8 hours की स्लीप बहुत जरूरी है, otherwise we can have these all medical issues in the body। and कनाडा के अंदर 6-7 टाइम जोन्स हैं। अगर क्या करना चाहिए डे लाइट सेविंग टाइम एंड स्लीप को पूरा करने के लिए कैनेडियंस को एज पर मेडिकल एडवाइस?
जी बिल्कुल। तो जब हमारी नींद पूरी नहीं होती है तो उसका जो प्रभाव होता है शरीर पर, वो ना केवल उसी दिन बट बाकी दिन पे भी उसका प्रभाव होता है। तो जो लोग 7 घंटे से कम सोते हैं, आइडियली रेकमेंड करते हैं कि हम 7 घंटे एटलीस्ट सोए, बट अगर 7 घंटे से कम नींद आ रही है तो जो मधुमेह या डायबिटीज़ है उसकी रिस्क बढ़ जाती है। हृदय रोग जो हार्ट डिजीज होती है उसकी रिस्क भी बढ़ सकती है। मोटापा के जो लोग मोटापे से पीड़ित है उनको वेट लॉस या वजन कम करने में दिक्कत आ सकती है। तो ये सारी चीज़ें जो है आपकी नींद से बहुत गहरा संबंध रखते हैं। एंड ये भी ज़रूरी है कि अगर आप ठीक से सो नहीं पा रहे हैं, जैसे ये बहुत ही आम बात होती है, जैसे नितिन जी आपने बताया कि कैनेडियंस 40% लोग जो है उनको नींद जो है, नींद की मात्रा कम होती है। तो अगर आप या तो आपकी नींद की क्वालिटी या क्वांटिटी दोनों अफेक्टेड है, तो ज़रूरी है कि आप अपने डॉक्टर से बात करें ताकि उसकी जांच कर सके, पता चल सके कि क्यों हो रहा है। बहुत सारी ऐसी कंडीशंस होती है जिसकी वजह से हमारी नींद अफेक्ट हो सकती है, तो ये जानना बहुत ज़रूरी है। एट द सेम टाइम जब भी डे लाइट सेविंग्स होती है, अगर आप 1 घंटा कम सोए हैं उस दिन, तो ये जानना बहुत ज़रूरी है कि जब आप उठे तो आपको कैसा महसूस हो रहा है। अगर आप थकान महसूस कर रहे हैं तो ये आपकी ड्राइविंग वगैरह पे अफेक्ट कर सकता है, तो बहुत ज़रूरी है कि उस दिन फिर आप ड्राइविंग ना करें। एट द सेम टाइम उसकी प्रिपरेशन भी कर ले आप। तो जिस दिन डे लाइट सेविंग्स हो रही है, अगर 1 घंटा जल्दी आप उठेंगे डे लाइट सेविंग्स की वजह से, तो ज़रूरी है कि आप 1 घंटा जल्दी सोए ताकि आपको वो नींद फिर भी मिल सके। एंड ओवरऑल जो है, जैसे मैंने बताया कि जो स्लीप हाइजीन जिसे बोलते हैं, कि कुछ ऐसी चीज़ें हैं जो आप और मैं जब करेंगे तो हमारी नींद की क्वालिटी इंप्रूव होती है। जैसे कि सोने से पहले आप स्क्रीन टाइम लिमिट रखें, तो फ़ोन या टीवी ना देखें। आप क्या कॉफ़ी या चाय का सेवन ना करें सोने के पहले, क्योंकि उससे आपकी स्लीप अफेक्ट हो सकती है। सकती है। और जब भी आप सवेरे उठे तो जितना हो सके उतना आप सूर्य की रोशनी को एक्सपोज कीजिए खुद को, ताकि उससे जो है बॉडी को भी जो बायोलॉजिकल क्लॉक होती है हमारी, जो डे और नाइट की जो साइकिल होती है, वो सही तरह से वो बैलेंस में रह सके।
Dr. Jan, thank you very much for this vital information, and thank you very much on this.
थैंक यू फॉर हैविंग मी नितिन जी।
Thank you.
Pleasure.